So our next presenter is Lindsay Hawley. Her topic is exploring the health fields. Her advisor at CBU is Chris Hood, and her community consultant, Steve Halsey. Lindsay, whenever you're ready.
When I was just 2 years old, my grandmother was diagnosed with a disease called Alzheimer's. For the next 10 years of my life, I learned about Alzheimer's and I saw my grandma deteriorate from it. She died on my 12th birthday. Since that, I have seen several friends and family members suffer with diseases, life-threatening, and just little ones. This is how I became interested in the health field. Several years ago, I had a life-changing experience. I visited an extremely poor Haitian community called the Taylor in the Dominican Republic, right outside of Haiti. These people have endless healthcare issues, AIDS being the #1 problem. For my grad challenge, I wanted to learn more about possible healthcare careers that I could pursue in my life. One way I learned about healthcare was applying and getting accepted to a program called MedQuest. This program is a week-long program at the University of Vermont. I spent time in different hospitals throughout Vermont and spent times in different departments in the hospital. One of my favorite departments that I was able to see was the ER. My community consultant, Steve Halsey, is an assistant professor in the Department of Surgery Division in emergency medicine. When an ER doctor in the emergency room, you need to evaluate the patient. By doing this, they use a computer program rating the patients 1 through 5. 1 being not so bad, 5 being in serious danger and need to be operated on or treated right away. The doctors then diagnose them, treat them, and/or discharge them, or send them for further care. This quote right here was from my community consultant: "You never know what's coming next." My community consultant and what I saw at the emergency room was very exciting. Obviously sad in some ways, but different at all times. You never know what's coming into you, which makes this job very exciting because you don't have to deal with the same issue and illness at the same time. Something that was also very exciting to me that I was able to shadow a surgical doctor in the Porter Hospital in Middlebury. This was incredible and fascinating. I never thought that half the things I saw were even possible. Tools used were unbelievable. One tool that I saw was called a cautery tool. You can't see it very well, but this is a cautery tool. This tool is used in many surgeries. It helps prevent patients from bleeding out and it burns the blood vessels. This tool smells terrible. My nose tickled every time they used it, which was just, it was an amazing experience, but also at the same time, I wanted to leave the room. I learned that becoming a surgical doctor can take up to 12 years, but can be a very exciting job. I saw many eye surgeries while I was there, which were very disgusting, but also amazing that it could be possibly be done. I was also able to interview a CRNA named Susan Long. They provide the same services as an anesthesiologist with an MD. This is one of the best nursing jobs you are able to get. Susan said, "Every week I meet somebody new who's my hero." She sees many different issues and illnesses. She's traveled to poor communities like I was able to travel to and stay there and work in many different areas. She says it's an exciting job and a great job to get into because it doesn't take as many years to become a CRNA as it does to become a surgical doctor, but you can have almost the same abilities as a doctor. I also wanted to learn about other ways to work with people dealing with illnesses. This led me to spending time at something called the Hope Lodge. The Hope Lodge is a home away from home. It's like a hotel for patients that live more than 40 miles away from their cancer treatment. When you have cancer and have a huge